afternoon, and thank you for being here this afternoon. Well, I am Stacy Holman. I'm the Vice President of Product Management at MEDHOST, and I've got over 20 years of experience in healthcare and healthcare IT. Today we're going to talk a little bit about MEDHOST, brief introduction. I'm going to talk about how we collaborate with AWS, and then we're going to talk about one of the solutions that we've collaborated with AWS on, the MEDHOST Mobility Physician and Secure Communications. About MEDHOST, our vision at MEDHOST is to be the trusted partner with healthcare organizations to advance the patient care experience and improve business operations. Our company was founded in 1984. We have over 600 employees, and greater than 20% of our revenue goes to R&D investments, investing in new products and enhancements for our customers. We support multi-facility corporate health systems, acute care hospitals, critical access hospitals, inpatient behavioral health hospitals, as well as long-term and post-acute care hospitals. We provide a multitude of solutions for the enterprise, departmental, as well as consumer engagement solutions. Our partnership with AWS, I'm going to talk just a little bit about that. We began in 2013 with the release of our cloud-based patient portal application. Throughout the years, we couldn't put everything on this slide, but we've continued development and working with AWS, including launching a condition management solution, price transparency, and moving additional functionality to the cloud to support our solutions and our customers. Most recently, in 2021, we used AWS Fireworks to support the sharing of patient healthcare data through the APIs to support the 21st Century Cures Act, which I'm sure that you all are aware of. So we're very excited about that solution. Continuing on this year and in the future, we're continuing to leverage AWS solutions to accelerate the development of new products and new enhancements for our customers. So one of those solutions is the MEDHOST Mobility Physician. I'm going to show you just a few screen prints to highlight what this solution does. As a physician, I can log into my patient list, see those patients that I need to visit on that day, whether I'm rounding for the group or for my individual patients. From there, I can select a patient to view their chart. So what vitals, results, any consultant notes, any allergies on that particular patient. The header at the top gives me key clinical information, such as the patient's allergies and demographics, so I know what patient I'm working with. By selecting on one of the chart tiles, such as vital signs, I can drill down to see more detail, and then I can draft to see that clinical trend for that patient. Also on the right-hand side, you'll notice that I have a little alert icon. So one of the big things with providers is having preferences and access to data quickly. So from the alerting perspective, we can push alerts to providers based on their preferences. So I may only want to see just those critical alerts, not all abnormals, so that we reduce that result alerting fatigue. So from that standpoint, the provider can receive that push notification at this rate, even before they get that call from lab, so that they can go ahead and make a decision for that patient and what's next. From a value perspective, physician mobility allows providers to have access to that patient's data either from within the hospital or outside the four walls of the hospital. So it allows that team collaboration and access to data. So I can be at the patient's bedside and talk about the results for that patient, talk about their treatment plan, and give them any key information as that I have it readily available from the iPhone or from the iPad. The other big benefit here that we've worked with AWS on is the Mobility Secure Communications. Here I've just added a screen print just to highlight a communication between care team members. So this allows me to easily be able to interface with that care team, whether it be the nurse, the social services, or consulting physicians, all together as we plan for the discharge of this patient. From a value perspective on physician mobility secure communication, we use Amazon Chime SDK to provide that secure and scalable messaging platform. It improves the quality of care by reducing the delays in care from those communication items. It also allows that multidisciplinary access to the care team and that communication. We can send these communications to a single user, multiple users, to a specific defined group, or the care team. So for instance, I may have a pharmacy group that we are communicating with, or antimicrobialship. Those sorts of things I can easily communicate with those groups. We use this is an example of, or to show our diagram of our architecture and the AWS pieces that we use within this solution. So this would be both the MEDHOST mobility as well as the secure communications platform. So it is a scalable solution that allows for multi-tenant, and it is serverless. So to put this into perspective as we walk through the example of the mobility, I could have a patient that is consulting on. So the cardiologist goes and sees a patient, they write that note. That note is available in AWS in the Firestore. When the attending physician comes in, we reach out to AWS into the Firestore to view that note. So that note is immediately accessible by that physician so that I can see what the cardiologist wrote. As the attending, if I had a specific question for that cardiologist, I can use the secure messaging to send a message to that cardiologist using the Amazon Chime SDK. So that kind of rounds us out about how we look at it from the end user perspective, as well as from the architecture and all the pieces that are involved from AWS and this collaboration. So if you would like to learn more about MEDHOST, our mobility solutions, or MEDHOST in general, or have any questions from a technology standpoint, we would invite you to look at our website or give us a call. And if you have any questions, we'll be over here on the side and we'd love to answer any questions for you. Again, thank you for your time.